And when they did, they went to a local hospital and they were tested, and the results have come back positive, and both came back today. We also have other people who are under what we call isolation, and they're under isolation now. Let me make that clear, because isolation is for ill people. We have other people who are still under quarantine who we are monitoring in the county who are not ill at this time. So for the 2 residents that are now officially under isolation who are ill, they have been symptomatic, again, the reasons that they were tested, but they are doing very well, and they are at home. They are not hospitalized. They were exposed in Westchester County, even though they're Rockland County residents, and when we learned of their exposure, they have been followed ever since they have returned to the county. We are monitoring, as of today, 10 people who are under quarantine at this time, and that's a voluntary quarantine. They agree that our staff will check on them daily, and they have been, and they are asymptomatic at this time. So again, we have anticipated this scenario. We will have more cases, I'm certain, and we will evaluate each one as they come across our desk. We have the most wonderful experts here in our county who have dealt with outbreaks before, most recently, as you know, the measles outbreak that we just ended at the end of September. And they continue at this time to evaluate the cases. There will be contact investigations performed for those 2 cases that have been diagnosed today. They actually are standing right nearby on my left side over there, probably not ready for prime time here today. Maria Soto is our disease coordinator, and I want to especially thank her, and our epidemiologist, Kevin McKay, who's actually performing a case investigation right now. And then Tatiana DeLuna Evans is also to the side. She's our schools coordinator and has been working with us through both outbreaks. So we have the best people, them and their staffs, who are working on this, and we will continue to update you as there's more information. Mr. Day has a few words now, and then we'll answer questions. Thank you.
Thank you, Dr. Rupert. And I'd like to echo some of the comments Dr. Rupert just laid out. First of all, we could not be in better hands than Dr. Patricia Rupert. She's an amazing professional. She has led the charge in the last time we had the battle against measles epidemic. I cannot say enough for the staff of the health department here in Rockland County, the amazing assistance we got from the state and other counties in combating the measles epidemic. And I can tell you, and I think anybody with a fair mind can tell you, that it's abundantly clear that we are ready and able to deal with whatever comes at us. Our battle against the measles was a template for any future outbreak. We have the strategies, the contacts, and the infrastructure in place, and we are ready. Our Department of Health is well prepared and experienced at monitoring at-risk residents and overall disease surveillance. I'll note that over 1,000 people were identified and had oversight over the measles epidemic. We had thousands of people interviewed to find out what their whereabouts were, all in service to the rest of the people of Rockland County, so we knew exactly where they were, so we could minimize any added issues. We are participating in daily state and federal briefings to maintain situational awareness and follow the latest guidance for monitoring anyone who has potentially been exposed. The governor has been doing a number of press conferences and informational telephone conferences, as has NISAC. So there's been a lot of information that we're getting to all focused on making sure we do the very best possible thing that we can do for the people of Rockland. They have provided guidance to local providers, healthcare facilities, federally qualified health centers, urgent care centers, school districts, and emergency medical services personnel. Above all, I remind everyone to just remain calm. The best thing you can do is listen to the advice of our professionals and our experts. Rockland County is ready, and I have faith in our health officials, institutions, and most of all, our people. Because together we can overcome any challenge that is set in our path. And as I said, I will remind all that we have met and defeated a similar challenge before, as recently as last year, with the measles, and we will do so again. With that, we will open it up to questions. Anybody wants to have questions on the matter?
Can you tell us about those, about those people who are tested positive?
I'm sorry, I couldn't.
Can you tell us about those people who were found to be positive with the coronavirus?
Where?
Changes,
You want to handle that?
anything like that?
I'm going to let the health commissioner handle that question.
Yeah, any other underlying conditions? I know that you said they're found.
As far as I know, they do not have any underlying conditions. We're completing the case investigations, hopefully today, and they are at home doing very well.
Male, female,
Does it matter?
like to know the ages?
All right, a male and a female. No, I don't give ages, sorry. 2 adults. Go ahead.
How many tests have you given, how many tests have you given in Rockland County for coronavirus?
Dozens. Couple dozen.
And do you foresee any problem with the number of test kits that you have? Well, we've been hearing that.
Yes, so, yes, they are, will be providing more test kits soon, but we have not had an issue yet with who we needed to be tested.
Was this man and woman a family by chance? Do they have children?
We are very limited, I'm going to make it a little bit easier for the Commissioner. We are very limited what we can say about people because of federal HIPAA laws. So we'll answer as much as we can. The answers the Commission's been giving, you can see the pain look on her face. It's a little difficult because she knows there's a line she cannot cross. And remember, the folks there are the ones who are protecting her identity.
Why don't we talk about what you can do? And that would be really helpful. Thank you. So again, not that it's exciting, but we remind everyone once again, it's flu season for starters. So for those who have not yet gotten a flu vaccine, we still urge you to please get a flu vaccine. And that will also help not only the person to decrease hospitalizations and complications, but also to minimize some confusion, right, with respiratory symptoms. So that's one. The other is hand washing with warm or even cool water can work, but most people prefer warm, for 20 seconds, washing the hands thoroughly, rinsing them first and then putting on the soap and washing in between the fingers, the front, the back, the nails, to really wash well. Recent study has showed that only 31% of men who go to public restrooms wash their hands. Talking about men and women, okay? And 65% of women. So it's still very insufficient, doesn't matter if you're a man or a woman. So how sad is that, right? That people don't wash their hands even after they use the toilet. But we're talking about washing your hands frequently, before and after you eat, when you come in from outside, even before you get in the car, if you can even use the sanitizer at that point, it would be very helpful. When you don't have soap and water, you use the sanitizers. But again, not that it's exciting, but that. Also coughing into the sleeve. Sneezing, if you have to, into a sleeve or a tissue. And again, discarding that quickly. Not using a handkerchief. Anything you can do to stay away from people when you're ill. If you're sick, stay home yourself and don't have company. Don't have parties. Try to stay quiet, stay home when you're ill, and not pass it to other people. Those are the non-exciting things that are really the most important as far as preventing this from spreading.
I know there's been a lot of concern though about healthcare workers who might have been exposed. Do we know what hospitals these two checked in to get looked at by chance?
All I know is it was a local hospital.
Do we know the nature of their exposure?
They were exposed to someone from Westchester County.
They
Thank you.
were workers, they were not attending, they were working at the bar mitzvah, that's what Cuomo said, is that accurate?
I didn't hear Governor Cuomo say that. I heard his press conference.
Ed, can you say more about when you say the infrastructure that we have in place? Can you be a little more specific how that would apply to what's going on with this with this case?
I would say, first of all, very similarly, there's very similar strategies are employed. We have to track people, we have to investigate where they were. But I would rather see Dr. Rupert speak to that because this is her infrastructure that she has created and implemented here in Rockland County.
So we have case investigators, including Maria Soto's team, who evaluate every case that we have and where the people have been, what their exposures are, the level of exposure, how close they were. For example, if you're passing someone in the hall is very different than if you're within 6 feet of a person, especially for a prolonged time. So that's the evaluations that are done. As far as we have the personnel, we here locally, we work with New York State Department of Health. In fact, we have a call later today that we'll have to get to in a little while, and we update with them sometimes more than once or twice daily. And of course, we also are in contact with the CDC, and we attend their telebriefings and webinars as well. Yes.
What is the procedure? A person feels sick, they go to their primary care physician, he gives them a swab test or whatever, and what happens? What's the progression of that?
If when they see their primary care physician or other physician, if it's felt that they need to be evaluated further and to have swabs taken, they are actually sent to the emergency room to do so, because at this point in time, full protective equipment must be worn in order to obtain the sample. So they are at this point done in the emergency room, not in the physician's office. And again, we're reminding people, I'm glad you brought that up, thank you,
Right.
that people need to call before they go to a doctor's office or to the emergency room.
From the emergency room, what happens to the test?
So then the test is sent up to Wadsworth Laboratory in Albany, and it's tested there at this time. They began to be tested there on Saturday, last week Saturday.
And what is the time frame from the time that a person is tested to the time you get a response as to negative, positive?
Usually we know within a day, depending on what time it gets up there.
How much longer will the two people be under observation or whatever they're in right now? Like, when did the quarantine or the isolation start, and when would it end?
So the quarantine, that's when people are not ill, begins when they have been first exposed, or if someone has traveled from when they come back in the country. That would be 14 days. The duration for those that are isolated now is being determined. We're going to follow their symptomatology and confer with the state.
So it's not a prescribed period?
At this point, it's not prescribed. Remember, this is evolving. This is a new virus, and we're following how it's transmitted, how communicable, how long it takes, and how long people take to improve.
So when did these people first go into isolation?
I don't have the date on me.
And were they symptomatic when they went into isolation, or was it just like, oh, I think I was exposed?
No, they became symptomatic during the time that they were quarantined, which is good, because that's the whole point of us monitoring.
How far away is your lab for having a sample, and what's the turnaround time?
So the lab is 2 hours away, and the turnaround time is usually within a day.
How many samples can you do in a day?
I don't do the samples. You mean Wadsworth Lab?
Mm-hmm.
I'd have to check their volume at this point.
Are they overflowed? Are you gonna have to?
No, what I heard on the news conference, which I know you might have heard the governor's conference just at noontime, was that they at this point have been able to handle the samples that they have received.
Any measures now going forward for police officers and those first responders who may not know what they're going to be walking into at all?
So they have been advised, right? They have been, and others are still being advised as to what they need to do. Everyone should practice universal precautions, when they enter, a
One more
home.
question, anybody?
Yeah, would you see a possibility that maybe a facility like this might have to be pressed into service if you had a lot of people who needed to be?
We're meeting to determine what next steps we'll take as far as what we'll need to do within the county. Thank you so much, all of you, and stay healthy, stay safe. Thanks for your interest. Wash your hands, cough in your sleeve, stay away from others when you're sick, and get your flu shot, please. We are still giving them out here at the health department if you're interested. We have our clinics that are still administering flu shots as needed, and every Friday morning, we also give them out right here upstairs from 11 to 12, and we'll certainly accommodate those who need other schedules. Thanks a lot. Bye-bye.